When are you going to give it? Is that cute?
I'm that good.
Is that cute? Huh?
All right, you ready?
You can't sign checks. I sign every one, right?
But I think it means a lot to our staff. I think that people are been waiting for this for a long time, so I think the staff's enthused. Remember, the frontline caregivers are doing all the work here, and for them to feel that they can be safe and also safe for their patients. So there's two sides to this coin, right? It's themselves, but really then if they're protected, they won't be at risk to their patients. So I think they're all pretty excited about it. So today, we wanted to be out here doing it first, just demonstrate that we think it's safe, we want to have it, we want to encourage everybody to have it.
How important do you think setting that example is, not just here, but for people who are watching?
Yeah, so there's a balance between whether we should do this or not, and I think most of our folks thought it was important to do it, to set the example. We're going to do it, we're standing behind it, and it's not a mandate, right? So we're encouraging as many people as possible to get vaccinated. So I think it was pretty important. I mean, I also have the pleasure of taking care of older patients myself, so a lot of them don't want to see you if you're not protected, so they're really more concerned. So for me, it's also a clinical issue.
Can you talk about what this means, the bigger picture of what this means, considering what we've been through the past 10 months and what your staff has been through the past 10 months?
This is the active part of the attack, right? Somebody used, I think it was in the Globe this morning, about the offense, right? This is the time where we can go and fight it without having to be on the passive side of things. This is our chance in the healthcare system to prevent the disease, make people safe, and get through this next few months. So it's really, really, really important.
Can you talk about what it was like to see these vaccines show up on the doorsteps this morning after all these months of one program?
Yeah, it was better than Christmas morning. I mean, if you think about it, we've heard people say light at the end of the tunnel. One of my colleagues said the eagle has landed. I mean, this has been pretty important for everybody in this region, especially here. So people are excited as hell. So I think, again, it's like Christmas morning, waking up, the Christmas tree has this big gift. Now we got thousands of doses. We can treat all of our direct line caregivers, who raves first, the ones who are most in contact with patients and our others. It's incredibly exciting.
What does it mean? You can talk about the differences between you've got a facility like Wounded Infants and like Kent, which is more on the front lines. What does it mean for each of those facilities to now?
Yeah, it was a little bit different, but there are different scenarios, right? At Kent, we're more COVID-centric. There's a lot of COVID patients. There's a lot of activity down there. Here, we have a lot of pregnant women, a lot of women coming in that are worried about that, and we have positive patients here, not as many as Kent, because their individual hospital functions are still specific to them. So even at Butler, and some of the Butler staff is here because they don't have their allocation yet, but it really is important to them because if one of them gets infected, we have to shut down a whole unit. So I think universally it's important for all of them.